are the implications of further restricting access to abortion in the United States? The lenses are ethical, political, economic, social, and psychological.
So in 1970s, abortion was a taboo topic, like it still is, but this case opened up a lot of discussion about the topic that wasn't there before. A Texan woman who went by the anonymous cover of Jane Roe, she wanted to terminate her pregnancy, but doing so was illegal in Texas. So she sued the Dallas district attorney, Henry Wade, and the court case went to the Supreme Court, and then the ruling was that most abortions are protected by the 14th Amendment in the Constitution, which is the right to privacy, and they said that women do have the right to choose their own health care, which includes abortions.
Learning about abortions also brings up the idea of the procedures involving abortion. These are some of the most common ones. This one is the abortion goes up to 9 weeks into pregnancy. Of these, the most common one is section alone, which is then 4 to 7 weeks into pregnancy.
Certain restrictions placed on access to abortion in the U.S. have negative implications regarding not only society but politics, economics, women's health, and ethics, which can be resolved by lifting certain restrictions on abortion.
The Henry J. Kaiser Family Foundation reported that in 2015, in the United States, 10% of abortions were performed on women who were 19 and younger, so mostly minors. Age-restricting abortion limitations are detrimental because when a young mother has to involve her parents, it can be more traumatic than the actual procedure itself. So from 1973 to 2013, the age demographics of women who received abortions have changed a lot, but there's still a lot of minors who are receiving them in 2013, which it doesn't seem like a lot, but it's like 5% of the total U.S. population of billions of women. So it does total out to be a lot more.
Looking through the political lens, abortion is a heavy topic. Political parties generally lean toward one side of the debate over the other. The Democratic Party favors the pro-choice side, whereas Republicans lean toward pro-life. People who are pro-choice believe that women should have the right to decide whether to have a child based on their own moral or religious beliefs. People who are pro-life support legal protection for the fetus and believe that the unborn child has the right to life. With Planned Parenthood funding, politicians in Congress are threatening to introduce legislation to defund Planned Parenthood. However, 1 in 4 women will have an abortion by the time they're 45 years old. So this legislation will leave many women without help and health care throughout the pregnancy. Looking at the chart, it shows the percentages of political parties who are for and against abortion. As you can see, the Democratic Party has the highest percentage for legalization of abortions. However, Republicans have the highest percentages for making abortions illegal.
Learning about the limitations and implications of abortion leads us to unsafe abortions. As laws and restrictions are made, it can lead women to go to unsafe abortions. The World Health Organization defines unsafe abortions as occurring when abortions are done by persons lacking the necessary skills or an environment that does not conform to medical standards, or both. Unsafe abortions have complications that can lead to death, such as hemorrhage, infection, and damage to the internal organs. When looking at the developing world compared to the developed world, the rate of unsafe abortion in the developing world is 56% compared to 6%. In the developing world, it is illegal in many of those places to get an abortion. Thus, it can be concluded that as abortion is made illegal or as restrictions are made on it, the rate of unsafe abortion increases. So, to prevent unsafe abortion, we should not restrict abortion as heavily. The
if restrictions were put on the social perspective, then young women would be a group that were heavily affected. They're affected because still being a child themselves, sometimes they're unable to bring a child into this world and they would be brought into unsafe living conditions. Another group that is affected would be the social class. A lot of times the lower class of the social group is heavily affected more than the higher class. And this being a reason, if restriction were put on the economic ones, it would make it more difficult for them to be able to pay for it. So before Roe v. Wade annual, 1.2 American women turned to illegal abortion to terminate a pregnancy, and an estimated 5,000 of them died each year from complications. This proves that if restrictions were put on social or economics, then lower class women would be faced to turning to an option where they would either terminate the pregnancy themselves, which makes it more dangerous for them, or they would have to wait a longer period of time, which also puts more danger in their procedure. Another group that is affected are rape victims. Rape victims a lot of times are argued that this should be one of the only groups that should be able to get abortion. Some people argue this because they feel their money should not go towards abortions that, for say, women who are too lazy to get a job or are able to pay for their funding. So with rape victims and taxpayers, their money goes towards only abortions in cases of rape, incest, and life endangerment anyway. So when they make that argument, they're actually contradicting themselves. Their money does not go towards for say, lazy women who do not have jobs. In this graph from 1987 to 2006, the amount of poor women who have unintended pregnancy rates have rise, and the amount of higher income women have lowered. 7 in 10 women would prefer to have their abortion earlier because when they have to wait to gain money or try to make themselves able to get an abortion, they increase the rate of having a more dangerous procedure done on themselves. Women getting an abortion between 6 and 10 weeks gestation can expect to pay about $350 at an abortion clinic and $500 at a physician's office. One system that tries to help funding for women would be Title X. In Title X, more than 4 million people rely on affordable birth control and reproductive health care services, and they are funded by Title X. Title X. If restrictions were put on Title X and different economic ways to try and support women funding for abortion, it could stop helping women financially, and the 43% of women that have some type of financial aid would no longer have anything.
For possible solutions, America could reduce the number of unintended pregnancies by enhancing the level of sex education in all schools. A limitation to this is that most private schools are against sex education that is not abstinence-based. However, they do not need to stop teaching chastity, but they should go more in depth with sex education to better inform the students on acts related to pregnancy.
Another possible solution is to lift restrictions that have to do with age limitations in all or most states. 37 states in the U.S. have age limitation based abortion restrictions. One limitation that we have to consider is adoption. A lot of people argue that women can just have their child and then put them up for adoption. However, the foster care system is not as reliable and not as good as what it could be. So while the foster care system is not very good, an option is still to be able to get abortions. Another restriction to this solution is birth control. But that also is not always reliable depending on the different methods, and not all insurance companies cover the cost of birth control. If restrictions were to be put on an economic or social perspective, the solution would be for the government to continue funding women's health organizations. Something that may be argued would be for how they do their budget or who would be paying for this, which Title X would be involved in this, and an argument that contradicts this would be Title X actually saves taxpayers money. In 2010, state and federal governments saved $13.6 billion from publicly funded family planning programs, including $7 billion from Title X. So, in conclusion, the economic was actually, Title X would save taxpayers money rather than causing them to spend more.
Okay, a couple of questions for you. I'm going to start with you, Maria. So, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem that your group identified?
I thought Brooklyn's lens of social and economic really helped my understanding because I had political and I didn't really go in depth with how it affected certain social classes and how like many people actually can't afford the abortion. So I thought that really helped me.
Okay, thank you. I'm going to go over to you, Claudia. What's an example of a compelling argument from one of your peers' individual reports that you decided to exclude from your team's presentation and why?
One thing that Jenna talked about was like waiting for like how far into the gestation abortions should be legalized or have less limitations or and whatnot. And that was a very compelling argument because there was a lot of research to support our side of it and a lot to counteract it. But we just found that her like talking about more unsafe abortions was more connected to everyone else's lens. But that part of her IRR was very interesting.
Okay, thank you. And next, Brooklyn. How did the group decide to include Claudia's perspective or lens or conclusion into the overall presentation?
In Claudia's perspective, she talked a lot about like how children would be affected if like women were forced to brought their child into like. So I included that in my lens because it affects like the social class, and I think Jenna included it in hers too because it would like she was talking about like how long the procedures were and like how dangerous it would be. So like it would affect the woman and like ethically.
Okay, thank you. And then finally, Jenna, in the future, what change would you make to your group norms? And then how would you expect that to improve your overall team presentation?
I think I would have added in more deadlines for when things should be done. We did finish it on time, but sometimes we were a little unorganized, and a lot of us had things to do outside of school, and it was hard for us to meet up sometimes. But by adding in more deadlines and meeting up a little bit more, we would have been able to organize our thoughts more, I think, and would have been able to make a more compelling argument than we already have.
Thank you.